Let's talk about schizophrenia with leading psychiatrist.
Hello, I am Dr. Priyanka Sahasrabhojanee, a consultant psychiatrist working in Porvorim and Mapsa, Goa. Today I am going to discuss a very important topic that every psychiatrist not only comes across, but it's something that's relevant to our entire society as a whole. And that is about how to prevent frequent relapses in schizophrenia. The occasion of World Schizophrenia Day, which is generally celebrated every year on 24th May, is the opportunity which I've taken to talk on this subject. Schizophrenia is a very common major mental health disorder, which we see in a population which is significantly high in countries and India, where we see around 0.1% of the population is affected with the disease. And this is a very crippling and disabling illness which hits the people in their prime youth, and it really disables them to the level of not being able to function well socially, in their academics, at their workplace, and in their personal life, relationships, everything. And therefore, this illness is something that really needs to be handled better, not just by the patient, but also by his family and the society and the mental health professionals around. A very important aspect of managing schizophrenia is preventing a frequent relapse. This is a chronic major mental health disease. So it's associated with episodes, and it is episode rather than episodes, I'll say exacerbations and a phase of relative remission. But a very important aspect of managing schizophrenia is not just handling exacerbations, but to prevent frequent exacerbations. So the phase in between is important, and therefore relapse prevention is important. The number one rule of relapse prevention is what we tell for the patient, for the family, for the mental health professional. We will divide this into T categories. So number one thing for the patient, one thing that's very important and not really taken well is compliance to medications. Yes, because medications are going to prevent relapse, which are related to the brain not functioning well due to the neurochemicals, which, as we all know, are deficient or rather haywire in schizophrenia. So a very important thing is non-compliance to medication, which can lead to relapse, and this has to be prevented. So the patient has to regularly follow up with his psychiatrist in order to make sure that he is receiving adequate doses of the correct medications for his illness. That is a very important thing which regularly needs to be addressed. The second thing that needs to be checked is that he needs to maintain a very regular and healthy lifestyle. By lifestyle, I mean that food and mood are related. So what he eats is how he thinks. So if possible, a dietitian's reference will be very prudent, because there are a few reasons for this. It's not only about food and mood connection, that healthy food makes the mind healthy, but also people with schizophrenia are prone to lifestyle diseases like diabetes, high blood pressure, high cholesterol, and many others. And also some of the medications used to treat it, the antipsychotics, makes one even more prone to them. So having a healthy lifestyle, which includes healthy diet, is very important. So it's prudent to see a dietitian. Second thing is movement through exercise. Exercise is very important to maintain not just a healthy mind as well as a healthy body in chronic mental illnesses like schizophrenia. Exercise will improve the blood flow to the brain and the entire body. It will also reduce the stress hormones, and therefore it will reduce the effects of stress hormones, which are very detrimental to the body. It will also help one cope better with the illness, and it will ensure general well-being. Also, it releases certain chemicals in the body which actually have an anti-aging effect. Mind you, anti-aging is not just about looking younger, but it's about staying away from many illnesses, right from diabetes to cancer. So yes, everyone should exercise here. The third thing that I would like to say is, which is very important in schizophrenia and to prevent relapse, is not to give in to addictions. like alcohol, tobacco, and many others, which they are very prone to because, in general, the schizophrenia leads to a state of poor motivation and lack of initiative in life. So they try to make up for it by succumbing to addictions, which should be prevented to prevent relapse. The next thing that I tell a lot is to try to bring in psychosocial, cognitive, and vocational rehabilitation for such patients. If this is not done adequately, then the patient is likely to relapse. What do I mean by that? Psychosocial is how one adjusts to the society around him, how he is taken well by the people and the society, how well is he accepted by them. Cognitive rehabilitation is how well is he able to perform well in certain functions related to his day-to-day work and anything that requires use of intellectual capacity. It can be anything from his activities of daily living to going to work or studying or whatever it is. And third is vocational rehabilitation. That is, these people have to be made ready to take up a simple job to make a living, anything. And the role of the family is to make sure that this is handled properly. So another thing is recreation. He should be into regular hobbies, a good soulful activity. If possible, any creative activity will also help. Now, what's the role of family? Family should avoid something called critical comments and expressed emotions. That is, they should avoid comments like, oh, you are mad, you are useless, you are good for nothing, what's there, it's such a burden to have you at home. No, because this can actually worsen the patient's the recovery process and to stay well. In fact, there are a lot of cases of schizophrenia patients trying to commit suicide because of a lot of expressed emotions and critical comments. So the family has to make sure that these are prevented. And the second thing that family should make sure is take care of themselves. That is, something which we have a good system is support groups. So there are support groups, that is, these are self-help groups, not just for the patients wherein they meet each other and discuss each other's lived experience, but there are also support groups that helps caregivers of such people to vent out, have a catharsis, and also pick in some valuable inputs from other caregivers who have had their own journey of as a person living with a patient with schizophrenia. Yeah. So caregiver support groups and the patient support groups carry a major role in relapse prevention. And the next is the role of mental health professionals. One very important thing that they should keep in mind is that they should try their level best to ensure psychoeducating the patient as well as the caregiver about the course of the illness, importance of taking medicines, importance of lifestyle and other measures, and social interaction, interpersonal interaction among all of these. That's very important. And the psychiatrist, as well as the clinical psychologist who is involved in the team, the psychiatric social worker who is involved in the team, all of them, and of course, the occupational therapist who are involved in the rehabilitation specialist team, vocational, cognitive, and psychosocial rehab team. They should all focus on psychoeducation and also helping to bring the patient at least back on track good enough to manage his own life. I think that's very important. So, in a nutshell, I think that illness can actually become wellness if we change the I to we. And we definitely have a way of fighting schizophrenia and to prevent relapse. But it's just that we all need to be together to fight this big devil. Thank you very much.